So in this lecture, we are going to discuss dental management with end-stage renal disease or renal failure who receiving hemodialysis. In the previous lecture, we discussed dental management with end-stage renal disease who undertake conservative treatment. Now, the patient receiving hemodialysis. Actually, we have to follow the same points that we discussed in the previous lecture. That means with the patients who undertake conservative treatment. That means we have to treat any infection aggressively. We have to avoid nephrotoxic drugs. We have to adjust drugs metabolized by the kidney, and also we have to what we call do screening laboratory tests for blood bleeding time and hemoglobin or hematocrit. All of these we have to follow as we mentioned in the previous lecture. So here also we have to concern of the arteriovenous shunt. Arteriovenous shunts, as we can see here, this is the arteriovenous shunts. Arteriovenous. This is in order to plug the patient to a machine. Here, the blood will be filtered artificially by a machine because the patient complained of renal failure or the kidney lost its function. So here, in order to remove the waste product from the blood, the patient should be plugged to a machine, and the machine will be filter the blood from the waste product. So the blood will be taken from patient to a machine, and then after filtration, the blood will be get back to patient. Actually, here, for this reason, we have to create what we call arteriovenous shunt in the forearm or in the upper arm. Since this is the shunt, so this is sometimes is more susceptible to endocarditis or endarteritis because there is infection, so the infection may transmit it to the heart and cause endocarditis or sometimes endarteritis. For this reason, prophylactic antibiotic should be indicated in such a case. Why? Because since there is a possibility of endocarditis or endarteritis, so we have to give the patient prophylactic antibiotic. That means before dental treatment, we have to give the patient antibiotics. This is also should be consult with the patient physician actually, because as I mentioned in the previous lecture, that some of the antibiotics might be nephrotoxic at high doses to the kidney. We have to avoid blood pressure, cough, and also IV medications. As we mentioned before, that benzodiazepam or even Valium can be given for safely for patient on conservative treatment and also the patient with renal failure. So here we have to avoid the hand with arteriovenous shunt. We have to avoid it and use another hand, even for measurement of the blood pressure. Avoid dental care on the day of treatment. Best treated on day after hemodialysis. Why? Here, as we know, that the blood will be taken from patient to a machine. So since the blood outside the patient or outside the blood vessel, so as we know, there is usually what we call anticoagulant. So here we have to add to blood anticoagulants such as heparin. This is to prevent coagulation of blood while it passing through the tubes of the machine. So we have to add heparin in order to prevent coagulation of blood while passing through the tube that connect the patient to a machine. So the effect of heparin should be finished, should be abolished, and the action of heparin actually lasts 4 hours. So we have to treat the patient on day after hemodialysis in order to be sure that the effect of heparin will be finished or will be abolished. So because of the heparin, the patient may be more susceptible to bleeding. And also there is another reason actually, which is that the platelets passing through the machine might be subjected to destruction. So because of destruction, the number of platelets will be decreased, and also the patient may be more susceptible to bleeding. For this reason, we have to avoid the day of hemodialysis and to give dental care or dental treatment on day after hemodialysis. Also, the patient cells plugged to a machine, and this machine used by many patients. So the possibility of transmission of hepatitis B is very high. So here we have to do screening for hepatitis surface antigen before any treatment. That means any patient subjected to hemodialysis, we have to screen for any hepatitis surface antigen, I mean the patient, in order to avoid transmission of the disease from the patient to a dentist. Because as we know that hepatitis, particularly type B, is more contagious and might be contracted from the patient to dentist. For this reason, screening for hepatitis surface antigen is very important. And actually, even the patient, we have to treat the patient, I mean the patient on hemodialysis, as a potential carrier. That means the patient may be carrier, but there is no sign and symptom. So we have to treat the patient as a potential carrier. So this is the end of the lecture, and thank you for your attention.